Ready?
All right, so today we're going to discuss the medically underserved rural population. My name is Keith.
I'm Brooklyn.
I'm Jessica.
I'm Melissa.
And I'm Lily.
So our primary objective was to gather a deeper understanding of the lack of medical care within the rural community as a whole. And we chose this topic because it's relevant to the agricultural industry. We felt this was a good blend of the two topics. So my assumption, and many of us assumed the same, was that rural community lacked the health care they needed because of lack of transportation and lack of specialties. This is especially prevalent due to the pandemic because there's just these things just aren't in the rural community. And my research and service learning pretty much pointed this out. Like patients wouldn't show up because of lack of transportation. They didn't have the funds to see doctors. Specialists don't work in the rural community, etc. So for my service learning, I'm a PTA student as well, so I wanted to work with a group that helped train healthcare students. So my role was to monitor simulations and basically learn how to be a patient actor, and I plan to pursue this later on anyways. So I wanted to see how students were trained to treat the rural community versus treating just the urban community. So one of the things I wanted to share with you is so they use this thing called moulage, which is just basically special effects. As you can see in the picture, that looks like an actual wound. It's not, but it looks real because that kind of real experience is what students need to treat real problems. And the next picture I wanted to show was with the iPads on the little segways. What that was for is they basically pioneered this technology in this area and helped spread it nationwide for better social distancing, better telehealth care, as well as so family members could visit with their family when in the hospital who had COVID and in the life situations. And last, I wanted to show the interprofessional education because rural health relies heavily on interprofessional training. Basically, everybody has to help everybody. You have to have a team. You can't, because we're already lack of resources and on our own. So this is important to have this teamwork when it's available. So for a lot of my cultural immersion, a lot of it tied down to the same things. Like this one was an interview, and that map shows all the rural hospitals that are closing. She basically got an RV, made a health clinic out of it, drove it around to meet her patients. And as we'll see in the next slide, this documentary was basically, it showed what this woman went through because all the health clinics around her closed. She didn't have money for transportation, didn't have money to go see the doctor to start with. So she basically didn't get the health care she needed until it was almost too late, which basically ties in a lot to the interview with the doctor who has the mobile van. And then this documentary here, those from 2012, it actually shows the timeline of how this keeps getting worse and worse. This documentary, talked about things were getting bad, lots of rural hospitals on the risk of being closed. Well, now they are closed. And that ties into this right here with the COVID pandemic for both the rural and tribal communities, because a lot of tribal communities and the reservations are in the rural communities as well. As you can see, this box building here, that's their clinic. And where I come from, we call that a Band-Aid station because that's pretty much what it is. The other lacked health care, friends of mine have went to places like this, and then their problems weren't as bad, they got a whole lot worse. And then pandemics has been even worse about that. There's just not been enough PPE, there's not been enough testing, and these communities have really been hit hard because of it. And then lastly, I wanted to include this comedic drama sitcom. Although I've only seen a handful of episodes, the gist of it is she moves from New York City to Alabama to take over practice in the rural community, and she has a big wake-up call from being in the big city and going to a little town in Alabama where she's the doctor. She has to do everything. She can't just refer out when she doesn't know what's going on. She has to figure it out because these people don't have anybody else.
Okay, so a lot like Keith, I had basically the same initial assumption, just that residents lacked affordable and easy access to healthcare. And then my research and my service learning basically confirmed this, but it was just for more complex reasons. Specifically in my county, it was an issue with a small population and lack of taxpayers. So for my service learning, I wanted to introduce telemedicine to rural communities where many people just lack access to technology or they just don't understand technology. So that's basically exactly what I did. I met with an IT volunteer in a rural area, and I I emailed local physicians, and I just shared contact information with people. My IT volunteer and the physicians, just to figure out ways that I could set up telemedicine in small spaces and libraries and other businesses like churches and stuff like that. Just to figure out a way that if we were going to go about this, it would be safe, even with COVID and everything going on. My service learning was basically just to focus on preventative and wellness. It was less for COVID patients and more for patients with other outstanding health problems that need consultations but want to limit their exposure to COVID. Just to, I guess, sort of stop the issue before it can proceed, because a lot of the primary concerns in my county is lack of transportation. So if you can catch a patient with, heart failure or lung failure before it gets out of hand, you won't need the ambulances and stuff later.
That's cool, Lily.
Okay, so my first cultural immersion was a documentary called The Providers, and this documentary is very reliable because it follows a doctor, a nurse practitioner, and a physician assistant around just to get their inside scoop on the issue of rural healthcare, and it just portrays the struggles of rural areas receiving healthcare. So this next culture immersion was a YouTube video, and I like this video because it discusses the positive aspects of working in healthcare in rural locations. There's struggles and there's not always available resources, but the doctors enjoy what they do and they enjoy the bonds that they form with their patients. So this next YouTube video was called Rural Healthcare, and this video also just discusses struggles, and it specifically discusses the struggles of finding and keeping rural healthcare workers. And it just discusses how the population ages and the ratio of elderly individuals to young individuals is uneven, so it creates more problems. This next YouTube video is called Rural Health Challenges. This discusses rural hospital closures across the country and how these closures affect other rural areas and businesses like pharmacies and other rural medical facilities around them. And then this last cultural immersion was a Television for Life episode on rural medicine called Health Matters. And these episodes interview rural healthcare professionals and provide the inside scoop on serving in rural communities. It just compares rural areas to heavily populated areas, and it explains how crazy it can get sometimes with only like one healthcare provider in a rural area.
So my assumptions were kind of the same as everybody else's. I knew that it had been hit hard by the pandemic, and I just knew that I had a feeling that they didn't have very many donations or volunteers because of it, so mine were kind of the same as Keith and Lily's. So my service learning, I did donations for the Compassionate Healthcare Center, which is in Fulton, Indiana. I set a goal for $100, and I have achieved that as of today. So my interview with the director of the center actually said that their funds are so down that they don't know if they're going to be able to keep the center open. So I thought that was a good idea to do service learning for. So my first culture immersion, this was just kind of an informative blog. It just kind of overly described what the medically underserved area was, just because I thought I needed additional information for that. This blog post kind of shows how a woman was struggling with a drug addiction, and she couldn't get her medication to overcome it because she didn't have insurance. So this kind of describes a firsthand look at someone who has the issue of being medically underserved, as does this one. A young girl actually wrote this and talks about how her family didn't have any health insurance and they couldn't get any of the treatment that they needed. And that's why they have these clinics, is to treat those that don't have the insurance. That's why I liked those so well, is because it provided those firsthand experiences to me. This documentary, I had a really hard time actually finding some on YouTube that I thought were appropriate. But this is actually a webinar where physicians discuss the medically underserved population. So I thought it was really cool to see each physician differently discussing their views on that topic. And then I actually watched a movie called Community Doctors, and it's about Cuba's medical scholarship program for United States students. And they would actually send these students to these areas to give them scholarships to go to medical school, so those areas do get service that they need. Sorry about that, Jessica.
So my assumptions before this project were also that there were many rural medically underserved communities in the United States. I assumed that it was because most medical students found that family physicians might be boring or wouldn't be as interesting as having a more complex or specialized area of interest. So after doing my research, I found that my assumptions were correct. And okay, so like Keith, I worked with the Rural Health Innovation Collaborative Center in Terre Haute, Indiana. So while COVID prevented me from being able to actually meet face to face, my community partners were very helpful meeting over the internet. So I got to learn about standardized patients for actors, and hopefully one day I will train to help them out and become one. And can you guys see me?
Are you back?
Can you guys hear me?
Yes.
Yeah, we can hear you. Sorry for the technical difficulties.
Okay, my computer just froze. Huh?
I can hear you.
Yeah, you're back now.
Okay, I'm sorry.
You're okay.
It happens.
This is part of it. This is COVID life now.
So I can't really hear you guys.
Can you see the slides?
I can, yeah, but everything else froze. So I keep going.
Just keep going.
You're good.
So for my cultural immersion projects, my first one was a documentary, and it basically followed several students from the leadership in medicine for the underserved at Michigan State University. It followed them while they went into the underserved communities and found out what areas needed the most help and how they could provide that help. So for my next one, it basically covered how physicians were more likely to stay in the state where they got their education and did their residency. So because of this, there are states that have a higher number of underserved populations because they don't have the teaching hospitals that other states have. This video focused on how advancing technology in the last few years has been a help to underserved communities, but they're still working to make that better for them. And then this video was about a Dr. John Gray, who is a physician in an underserved community. He chose to do this because he grew up in a medically underserved community and he wanted to be that help that he didn't have. And this movie, it's just your typical Hallmark movie about love and holiday miracles, but it also is about how a big city doctor has to go to a small town in Alaska that's not had a real doctor in years, and he's kind of awakened by how much she actually has to know, and she just chooses to stay as a small town doctor.
Good job, Lily. I mean, Jessica, sorry. And Lily and Keith.
I love Hallmark movies, so it's relatable.
So my assumption was basically based off of experiences that I've had and what I've seen with my peers growing up. For example, I've had a friend that the family literally couldn't afford health insurance, so they didn't go to the doctor, and they just never went because it's something that everybody to an extent deals with. And I feel like in those situations, when you are lacking the access to coverage, those illnesses that you're having can lead to terminal issues, which is bad. And after doing research, it basically just confirmed that individuals do have a really hard time getting access to coverage, and there's a lot of reasons that go into that. For my first immersion activity, I did a documentary, and it is called Where to Invade Next, in 2015. And Michael just basically explores like different countries and how they deal with just issues going on medically and economically. And it's cool to see how we can learn from different countries on how to deal with these ways, because as of right now, our health system really is lacking and individuals are suffering. My 3 YouTube videos that I did was, I really enjoyed these. They're real people, they're real stories with how they're suffering, getting access to healthcare. And the first one, Emily, she has bladder issues, and it got to the extent where she needed to have a hydrogen surgery. As having Blue Cross Blue Shield as well as her, there is, when you get into that insurance, they place you into certain groups, and you're only allowed certain providers to help you. She found a provider, went to him, he couldn't end up helping her because of the group she was put in. So Blue Cross Blue Shield, like the insurances, they're built hard for individuals to get access easy for them. And that goes into Cynthia as well. And then lastly, Janet, she just basically describes her income mostly goes towards her medical expenses. How much she has to pay on her coverage, her deductibles is just insane, and how much of your income you really have to set aside and plan to help yourself medically. And then my last one, as well as Lily, I believe, we did the providers. And I really like this because Laura and Anna actually grew up in the medical field, and they were around it all the time, but they just wanted to get a deeper look into how people are suffering on the other side of it and kind of see it through their lens. So they did follow some nurses and doctors to see the reality of it. And they got to see, just again, what it looks like for an individual with not getting proper health care. And then for my service learning, I did a fundraiser with March of Dimes in support of health and babies. And it's something that is important right now, as 400,000 babies are being born prematurely, and families are having issues with the costs that come along with that. And I don't think it's truly fair in the families that this happens to them. It's nothing that anybody can expect. And I just wanted to help. My goal was $300, and I'm currently at $10. I did this service learning basically because it was most appropriate for me to do with everything going on right now.
So kind of to wrap up everything, I guess our group experience, it all kind of goes along together, I think. Wouldn't you guys think?
Yeah, for sure.
Mm-hmm. We all kind of
Definitely.
assume the same thing.
I think my experience is pretty similar to all of the research that we compiled together. Really, the only difference is just that the area that I focused on wasn't as rural as some of the areas in our overall research.
Right. Like, so a big thing in healthcare anyways is research-based practice, RBP. And I'm sorry. And so when we experience this stuff and then research it and then it adds up, like that's kind of a big deal. What's kind of surprising is we have all this research, yet the medically underserved rural community still exists, and it's getting larger and worse and worse.
Yeah.
So it's kind of That's kind of like a big deal. We need to bring this research into the practice, so to speak.
Mm-hmm. And then I think with the last one, all of our immersion experiences are really similar. I know that like Alyssa and I had firsthand experience, like videos, and then everybody else kind of had a really good movie. And then I think we all had really good service learning projects too that we can all compile into our research paper to make it really good.
Yeah, definitely. I think our service learning projects all varied enough that we were able to see different aspects of the issue, but they all related in terms of, the rural underserved medical community is struggling.
Mm-hmm.
Right.
Yeah, I think hearing like all of your guys' experience with the project kind of opens all of our eyes in different aspects, like you said, how different all of our service learning was.
Right, because the place I was at, they weren't lacking funds; they were lacking volunteers. But like a lot of places you guys worked with, they just were lacking funds altogether. And so, I was aware of that for sure. But since my service learning wasn't surrounded around the lack of funds, it was one of those things that didn't cross my mind until you guys brought it up. Like, Brooklyn, you said that your place is going to close if they don't get enough money soon. Well, where I'm at, they have a large collaborative of different schools, different programs, different training corporations that all work together. That I won't say that their funds are endless or not, but their funds are not a major concern. It's more of a secondary concern, if that makes sense.
Mm-hmm. Yeah.
So it was just like kind of surprising for me to see that because it just wasn't something I experienced in my service learning.
Right.
With that center, I'm glad I ran into them because they are needed volunteers, and I do actually plan to keep working with them and maybe become a volunteer myself.
Mm-hmm.
Yeah, that's good. I think this all opened our eyes to the issue a lot more than we had, what we already knew.
Right, because I come from a position of, I guess I want to say privilege, because like I've never lacked healthcare. I've never, yeah, I live far away. I guess transportation maybe, but like if I needed healthcare, we immediately went. Like we didn't worry about the price because we had good insurance, and our insurance isn't as great now, but for varying reasons. But I still have good enough insurance. Like I can go whenever I need to. I have a working vehicle. I can go see a specialist if I have to. It might be a little bit of a drive. That's really my only preventative thing. Whereas, heck, I have neighbors right down the road who've never basically seen a doctor. Maybe once, but not enough to really matter. They get a cut, they just super glue it back together. Big introduction for a bacterial infection. They don't know that. Like, oh, they use it in Vietnam, so it's going to be fine on me. Yeah, well, when you lose your hand, it's not really going to be fine, bud. But they don't know that because they don't even think about going to the doctor. Whereas me, I go get stitched up or get some surgical glue or what have you.
Mm-hmm. And it's nice to hear like different perspectives on like how we all grew up, like getting access to healthcare, because like I'm kind of on the opposite side. Like my family kind of struggled with it. We didn't have the best insurance. So the medications that you get, they're not the best medications. Personal experience, I went to Mexico and got parasites. I came back and I couldn't afford the medication. It was $200 per pill. And there's just no way I could have afforded it. So my health insurance gave me a less effective prescription, and it's just stuff people really don't think about and the effects that can come along with it.
Right.
It's nice to hear all of your guys' perspectives on it.
Yeah, it's the unfortunate reality of, the underserved community.
I think everybody did a great job.
Yeah.
Brooklyn, y'all did great.
I agree.